Welcome to today's HealthLine webinar from the American Association of Kidney Patients titled Hope for Patients with Rare Genetic Kidney Disease. Thank you for joining us today. My name is Jerome Bailey, and I'm the Director of Patient Engagement and Advocacy for AAKP. Today's HealthLine webinar event is a special collaboration with our longtime allies at the Rare Kidney Disease Foundation, as we recognize National Rare Disease Day, observed on the last day of February. AAKP supports kidney patients across the disease spectrum, including those affected by rare and genetic kidney diseases. Through this partnership, we aim to increase awareness and expand understanding of these conditions. As science advances and research progresses, we have come to realize that rare diseases may be more common than previously thought. As the oldest and largest fully independent patient-led kidney patient organization in the U.S., AAKP is proud to host webinars as part of our mission to empower fellow kidney patients, family members, care partners, healthcare professionals, researchers, and policymakers. AAKP's HealthLine and HealthLine Innovative Webinars fall under our Center for Patient Research and Education. We believe patient and care partner education is an integral part of an individual's treatment, and to that end, AAKP is a champion for full patient care choice, the protection of the patient-doctor relationship, and the elimination of artificial barriers and government determinants of health that impede patient care choice and access to available treatment options. At AAKP, we work to ensure that patients have a central role in the research and development process so that unmet needs are identified and unique patient insights and lived experiences fully inform innovation and the product development lifecycle. This includes clinical trials to regulatory action and payment decisions. Through our initiatives, we aim to ensure patients have a central voice in research and innovation. By leveraging lived experiences and unique insights from the kidney community, we help drive meaningful advancements across the entire product development lifecycle, from clinical trials and regulatory processes to payment decisions. As medical science progresses with personalized medicine, cutting-edge technologies, and novel treatments, the potential for better outcomes in kidney care has never been greater. To kick off today's program, I would like to introduce AAKP's Vice President and Chair of Policy and Global Affairs, Paul Conway. Paul is a passionate advocate for patient-centered care, patient participation in true shared decision-making, and the use of patient insights in kidney research. As a kidney disease patient himself for 47 years and a 28-year transplant recipient, he has been recognized for his advocacy work with several national awards, including the Presidential Lifetime Achievement Award in 2022. Paul has served in 4 U.S. presidential administrations, including as Chief of Staff for the U.S. Department of Labor. He has served on multiple federal and nonprofit committees and boards related to kidney health, including as Chair of the FDA's Patient Engagement Advisory Committee, the American Board of Internal Medicine Nephrology Specialty Board, and the National Institutes of Health Kidney Precision Medicine Project, and most recently, as a board member for our partner organization featured today, the Rare Kidney Disease Foundation. Before we dive into today's discussion, we wanted to hear directly from kidney patients about their experiences with rare kidney diseases. So, through our AAKP's Center for Patient Research and Education, we conducted a quick survey to gather key insights. Paul is here to walk us through the results. Paul, over to you.
Thank you very much, Jerome. And again, thank you to the Rare Kidney Disease Foundation and the founder of that organization, a fantastic patient advocate and a patient himself, our good friend, Richard Nelson. So these insights that we're about to roll through with you inform our advocacy efforts and those of the Rare Kidney Disease Foundation. We also share these insights with the media and elected officials on Capitol Hill and in the White House. Our first question was to patients, do they know the specific cause of the disease? And about 73% say yes. No is over a quarter of patients. We asked, when originally diagnosed with kidney disease, was a cause of your kidney disease known or provided to you? And about half of them had a cause that was provided to them, and about half did not, which aligns very closely with what AAKP hears regularly during our events from patients. There's a great interest in trying to drill down and find out, why did I get kidney disease and what's going to happen? What's the path forward? So in terms of the actual cause of disease, you can see here over 20% identified it as MUC1. This is a particular disease that Richard Nelson, the Rare Kidney Disease Foundation, have done groundbreaking work on in conjunction with academic and clinical experts throughout the world. FSGS, a lot of us know that, 11%, diabetes type 2, Alport syndrome, hypertension. You can see the clustering there, and then other or unknown is about 27%. And then, however, the symptoms of kidney disease impacted your daily life, we asked people to check these off. I'd pay particular attention to the top two: emotional distress, anxiety, and depression that comes with a diagnosis. We're very focused on impact on work, so difficulty working or maintaining regular part-time or full-time work hours. AAKP defines kidney disease as both a healthcare and workforce issue because it interrupts people in their careers and in their professions and trades. If you go down and take a look at some of the smaller numbers, physical activity, daily tasks around the home, and then other is another category that has a lot of subjective feedback that comes from patients. It's very important for us to know, and we'll share that in different discussions with organizations like CMS, FDA, and NIH. Has genetic testing ever been recommended to you or a family member to help identify your cause of kidney disease? This is an astounding number. Almost 82% of those who answered the survey had never been offered the opportunity. Only 13% said yes, and 5% were unaware. And then, how many healthcare professionals did a patient consult before receiving the rare kidney disease diagnosis? You can see about 75%, 1 or 2 professionals were involved. Some go a further distance, they have 3 or 4, and some have 5 or more. This is very important for people to understand because the number of people that have the expertise to closely identify a rare kidney disease in one person or one professional is limited. You usually end up getting 2 professionals or more, and this is all the more reason why it's important to have access to genetic testing when it's appropriate and a patient decides to go ahead and pursue that with a healthcare professional. What kind of information or support do folks wish they had more available during their diagnosis and treatment? You can see almost 40% indicated more information about their specific rare disease. And then these are the things that we find very important and helpful to patients: connections with other patients, financial assistance or insurance support. And then in other, one of the primary categories that came up in this from patients was being equipped with the tools necessary to discuss genetic testing and rare disease with other family members, which is very important. And I know that the Rare Kidney Disease Foundation does fantastic work in that regard. In regard to genetic testing, what do you consider to be a fundamental basic that patients should expect in order to keep their information well protected? This is probably one of the most important questions that we asked in this survey. So the vast majority of patients wanted full assurance that their unique, personally identifiable data would only be used by those you agreed to share it with directly, meaning no secondary or third parties. In the next category, about a cohort of folks said they wanted to be fully informed and given the opportunity to approve or say no to any subsequent request to share your data with other researchers or companies beyond the primary person you agreed with or organization you agreed with. And then another subset, about 25% of respondents, said that your data would not be shared without your express written consent with any researchers or companies with ties to foreign governments. For example, China. This is actually an emerging issue given how much work has been done at the federal government level on issues related to bogus research that originates in China, as well as growing concerns about American competitiveness in the development of new drugs versus the theft of genetic and IP data from other drug developers and from patients around the world under the auspices of Chinese companies. And then in the last question here, clear language in all materials, 13% thought that was a fundamental basic. But when you take a look at these particular answers, these are the types of things that people want in disclosure. They want transparency, and you can clearly see that patients raise their voice and have their viewpoint very clear when it comes to what they consent to. That's a very important thing for us. And a question on Has your rare disease made you more interested in advocacy work related to research funding and better regulatory and payment policies designed to accelerate safe new drug treatments? 75% said yes. 25% said no. This is very important when you think about the level of advocacy that has to happen and has to continue to happen to make certain that private sector, nonprofit sector, and government sector funding continues, and to make certain that there is an alignment when new drugs and products are approved and that they are paid for by sources like private insurers and Medicare. This slide was interesting on the path forward. Would you be interested in helping raise awareness about the unmet needs of rare kidney disease patients to congressional leaders in the White House? 50% said yes, 50% said not sure. And so at AAKP, we take this slide to mean we have opportunities to provide to patients to get more engaged, and we need to explain how their efforts and their investment of time helps make a difference in the eyes of appointed leaders in the White House and in the executive branch and with elected leaders in Congress. But make no doubt about it, the insights that we were able to gather through this survey are very, very important, and we deeply appreciate the patients that offered their views and took the time to fill this out because it helps us be more effective on their behalf. The issue of rare disease is an interesting one in an era of greater patient advocacy and precision medicine because we have the chance to bend the curve of kidney disease and prevent kidney failure and being assigned to the waiting list if we can interrupt diseases earlier through better medicines and better products. That's exactly what we're trying to do. We're trying to reduce human suffering. And what fuels that drive in this era of the decade of the kidney is patients. Patients getting involved in clinical trials and patients advocating to their elected and appointed leaders. The voice of patients has transformed kidney care, and the voice of patients can't be ignored. That's why we strongly encourage you to participate in other events that are put forward by the Rare Kidney Disease Foundation and AAKP. We are allies, we're united, and we're determined to make certain that more patients have the opportunity for genetic testing if they choose to do it, and that they have full transparency and consent at every step of the way. Thank you very much. I'll throw it back over to Jerome.
Thank you, Paul. I appreciate that very much. Today, we are thrilled to have two great speakers with us today. We begin with Sharon McGroder. Sharon received her PhD from Penn State University and spent 30 years as a family policy researcher in Washington, D.C. After retiring, she began volunteering with the Rare Kidney Disease Foundation in May 2024 and became its executive director in December 2024. Diagnosed with stage 2 chronic kidney disease in her 30s, Sharon is now at stage 4 and on the kidney transplant wait list. With a strong family history of renal failure, she suspected a genetic link and in 2017 joined a research study led by Dr. Anthony Blyer at Wake Forest University, where she received genetic testing confirming she has ADTKD MUC1. Now Sharon is dedicated to raising awareness about ADTKD and supporting research efforts to develop treatments and ultimately a cure for this rare genetic kidney disease. Sharon, I turn the program over to you.
Thanks, Jerome. Hi, everyone. I'm really happy to be here today to speak with you all about ADTKD, which stands for Autosomal Dominant Tubulointerstitial Kidney Disease. Now, it's a mouthful, but I will describe what it is and why it's important to know about this rare, but not as rare as we once thought, disease. First of all, what is the Rare Kidney Disease Foundation? We're a patient-driven, patient-focused, nonprofit organization dedicated to halting the devastating impact of ADTKD across generations by supporting physician scientists in their quest to find a treatment and, as Jerome said, eventually a cure. Our vision is we see a world in which genetic kidney diseases are diagnosed early, treated effectively, and eventually eradicated, saving lives and rendering dialysis and kidney transplant unnecessary. Our mission, we offer hope to families, first and foremost, families and patients with ADTKD, by raising awareness about this disease, the promising treatments on the horizon, and options for genetic testing. Second, we build engaged communities of medical professionals, patients, and their family. And then third, very specifically, we are dedicated to finding and referring 300 patients to join the International ADTKD Registry at Wake Forest University, which will serve as a potential patient pool for an upcoming clinical trial of promising treatment. And I'll talk more about that in a moment. So today, I want to start off by talking about a couple numbers, key numbers you should know about this disease and about rare diseases in general. Then I'll tell you more about what is ADTKD, and I'll go over the symptoms and the defining features, what it is that characterizes ADTKD. I'll discuss how it's diagnosed and whether there's a treatment, or basically, more specifically, what's on the horizon for a treatment. And then a little bit about my experience as an ADTKD patient, which Jerome also talked about, so I'll just kind of wrap up with a couple other things of reflection. There are 37 million individuals in the United States with some sort of kidney disease, and it's estimated that up to 10% of those with chronic kidney disease, so that's 3.7 million people, have a genetic mutation that causes their disease. So that's a lot of people whose kidney disease may be genetically based and they don't even know it. Second, ADTKD is the second most common genetic cause of kidney disease after polycystic kidney disease, with an estimated 75,000 to 100,000 patients in the US and could be up to millions worldwide. So what is ADTKD? What it is genetically is the gene mutations cause abnormal protein production that basically damages the kidney. And so that's what leads to slow progression, the progressive decline in kidney functioning until transplantation or dialysis is required. Now, there are 7 different subtypes that they've so far discovered of ADTKD, and each has their own little tweak. But the 2 most common are what we call ADTKD UMOD and ADTKD MUC1, and those are named after the genes that are affected, the UMOD gene and the MUC1 gene. So those 2 variations comprise the vast majority of ADTKD. In terms of the symptoms, there are 3 defining features of ADTKD that all of the subvariants share. And that is, as I already mentioned, slowly progressing chronic kidney disease. So this is not something that happens overnight. It could be decades where creatinine levels are gradually rising and eGFR is gradually dropping. A key red flag is that a parent also has CKD. And that's why it's called autosomal dominant inherit, because it's like brown eyes over blue eyes. If you remember your high school genetics, it's dominant in that you only need one parent to have it. And if a parent has it, there's a 50-50 chance they will pass it down to each of their children. So if you are a patient and you're your parents and it runs in your family in previous generation, that is a huge red flag that your disease may be genetic. The third defining feature is that there's no blood or protein in the urine, and this is what doctors call bland urinary sediment. Now, if you're a kidney patient already, you have chronic kidney disease, you go to your nephrologist, you always, they take a urine sample, because typically most kidney diseases happen in the glomerulus, and that's where a lot of the filtering of waste happens. And that's where, if you have a disease in the glomerulus, you will spill protein or blood into the urine. So that's why doctors check for that. The thing that's insidious about this disease, it happens in the tubules of the kidney. And what that means is you won't see blood or protein in the urine. And so again, it's a red flag, because that's very not normal to have chronic kidney disease and to not have blood or protein at some point in your urine. So again, I call that a red flag. If you have any of those, or especially all of those 3 defining features, you may want to talk to your doctor about ADTKD and consider genetic testing. And I'll talk to more about that in a minute. In terms of other symptoms regarding specifically the UMOD variation, that they found that about 50% of those patients experience hyperuricemia, and uric acid is the waste, one of the wastes that your kidneys clear. But folks with the UMOD variant have a lot of uric acid early in their teenage years, often accompanied by gout. So if you had or a family member had gout in their teenage years or 20s, that should be a red flag that you may have the UMOD variant of ADTKD. So in terms of diagnosing ADTKD, as I mentioned before, if you have all of those three defining features, you should really consider that you may have ADTKD. And again, the major red flag, the first red flag is if you have kidney disease that runs in the family with no known cause. So it's not related to diabetes. It's not related to other diseases where kidney failure is a secondary outcome. For primary chronic kidney disease, if it runs in the family, that's the red flag that it's likely genetic. In terms of diagnosis, the most definitive test is genetic testing. And kidney imaging or biopsies do not help diagnose ADTKD. So it really is key to get the genetic testing if you want to know if you have this rare genetic disease. In terms of a treatment for ADTKD, currently there are no treatments or cures. So the focus really is on managing symptoms, for example, monitoring and managing high blood pressure, and adopting healthy behaviors such as eating a kidney-friendly diet, whatever that means for the stage of kidney failure you're in and whether or not you're on dialysis, but following the recommendations for a healthy diet, given your situation, seeing your nephrologist regularly, and getting regular exercise. So it's just about managing the symptom up until recently, where there's been discovered the drug-like compound that's been identified that could halt the devastating impact of UMOD and MUC1 versions of ADTKD. And those were discovered by the Broad Institute of MIT and Harvard and their affiliate NUCO. They plan to conduct a clinical trial of this promising compound in the near future, which is exciting news for those of us with ADTKD. In terms of my experience with ADTKD, Jerome mentioned that I am currently in stage 4. It runs in my family. I'm one of 6 and 4 of us, so a little more than 50-50, have the gene variant. My mother is one of 6, and 4 of them had kidney failure. They didn't get the genetic testing. It wasn't available at the time, back in the 70s and 80s. My grandmother died from kidney failure. My mother died also pre-transplant. So I'm very committed to helping the experts find a solution, find a cure. Starting with a treatment, first is treating it so it no longer progresses, and ultimately a cure so that my children, my grown adult sons, don't have to deal with this disease. But the happy news I do want to share is, although I'm on the transplant list and I'm at stage 4, I did pursue a live donor, which I recommend everyone pursue as soon as possible, which in my case was as soon as I did the kidney evaluation when I was at about eGFR 22. As soon as I dropped below 20, I was eligible to be placed on the list, but that's also when my husband decided to get testing for an evaluation to see if he could be a donor, and it turns out he's a perfect match. And so, knock wood, when my time comes, I've got my husband to donate so I can avoid dialysis altogether, which I think is the ideal, given what I've seen my mom, my grandmother, all my family members go through with this disease. So thank you for inviting me, Jerome, and AAKP to share what we've learned about ADTKD. And if you want to check us out, you can email us at info@rarekidney.org. Our website is rarekidney.org. And if you'd like to donate to help us spread the word about this disease, or if you want information on genetic testing, you can see the QR code there. And if you're interested in volunteering with us, we'd love to have you. We have a lot of work that needs to be done. We love our volunteers. And we're very grateful for Autumn Seen, who you'll be hearing from shortly, a recent volunteer who's just already made an amazing contribution to the foundation. So thank you very much.
Thank you, Sharon, for that very enlightening presentation. And next, please join me in welcoming Autumn Carol Steen. Autumn was born and raised in the small town of Burnsville, North Carolina, as part of the large Carroll family, the first to be identified with ADTKD, UMOD, by Dr. Anthony Blyer. Her family's experience with kidney disease has deeply shaped her journey. Her father passed away from dialysis complications at the age of 50, and her brother received a kidney transplant at just 30 years old. Now 37, Autumn is living with stable stage 4 chronic kidney disease. She is married and a devoted mother to her 4-year-old daughter, who, thanks to genetic testing and in vitro fertilization, does not carry the disease. She currently resides in Asheville, North Carolina, where she serves as a clinical pharmacist practitioner at a local family medicine clinic, combining her professional expertise with her personal passion for patient care and advocacy. Please welcome Autumn to the program.
Thank you for having me.
So, Autumn, can you share what it was like growing up in a family with a history of ADTKD, UMOD, and how that shaped your awareness of kidney disease?
So, for me, it was ever present. My dad was one of 14 children, and it was, to me as a child, normal to see them progress to needing dialysis or a kidney transplant. In my early years as a child, we didn't really know why, but we just knew it was something that ran in our family. Um, and so over the years, once we finally were all diagnosed and had a name for the disease and genetic testing was available, um, it felt like the logical next step to learn more about it, to get diagnosed with it, both me and my brother. And so it's been a normal part of my life, which I actually feel pretty grateful for, that I was able to grow up with it instead of getting diagnosed later in life.
What were the early signs or symptoms that led to your diagnosis? And how did your family history influence your approach to managing your health?
I had no signs or symptoms. Thank goodness. I'm thankful for that. I was first diagnosed when they discovered the gene. And once they discovered the gene, I believe I was asked if I wanted to know. I was about 13 when that happened, and it actually felt pretty normal for me to get that diagnosis because I knew my dad had it, and I also knew that my brother, was diagnosed at the same time. But I'm lucky in that I've never had really any signs or symptoms of this disease. Um, Although my doctors tell me that I probably am tired and fatigued more than I realize because I've always been anemic. But other than that, I've been lucky.
Can you talk a little bit more about the diagnostic process and what was that like for you?
We would have these really large family meetings for all the Carols in Western North Carolina, where I grew up. And when Dr. Anthony Blyer was searching for a cause, he took samples from all of us, our blood and our urine, and then he asked our permission if he could, enroll us in a trial or future studies to figure out, if this was a genetic cause. And then that's when he found the disease. And then that's when I was told that I also was affected. But it really wasn't a monumental diagnosis for me at the time. Like I said, it all felt very normal for me to have it since so many of my family members had it.
And talking about genetic testing, how has that impacted, decisions for future generations of your family, including your daughter?
Yeah, so that was one thing that weighed heavy on me was as I got older, as I was dating and would become serious with someone, I did felt a heavy guilt on my shoulders, to the need to tell them, the need to inform them that, hey, if I have children one day, there's a 50-50 chance that my child will also have this chronic condition that does not yet have a cure. And so when my husband and I were getting serious before he proposed, we had this long discussion, and he let me know that he loved me, and that was not really a factor in his decision to be with me, which was a huge relief. And then he and I, over the years, while we were planning our wedding, we were talking about having a family, and that's something I've always wanted. But I still had this heavy guilt and burden of passing it on. So I had basically resigned myself to, maybe we adopt later on down the road, but certainly it doesn't make sense for me to have children. And not everyone in my family feels that way. It was it was a personal decision. But I actually ended up bringing it up to my nephrologist, who I've become close to. I've been seeing him for many years now. And he suggested that we go through genetic testing and testing embryos before IVF. That felt like a doable option. I was pretty optimistic, naively optimistic, I would say, that we'll just do IVF, we'll test the embryos, and we'll implant one that does not have the disease. And ultimately that is what happened, but it was much harder than we expected. It took about 3 years and some complications, and an ectopic pregnancy, and a couple lost embryos. It was really difficult physically, really difficult emotionally. It did work out for us, which I'm very grateful for. But yes, I'm very grateful for the genetic test itself, so that I had that option, and for, of course, science and the time I live in, so that I had that as an opportunity.
How have you managed your kidney disease to maintain stability at stage 4 CKD?
I don't know that, I guess we really don't know what it is that helps people be stable with this certain kidney disease. Of course, there is common sense measures that I try to follow, like exercise, and I do follow a plant-based diet. I was more strict in a vegan diet years ago, and now I'm more a vegetarian. But I do avoid animal protein as much as I can. There is some pretty good evidence that that is helpful for kidney disease in general. Of course, we don't have really good data on our specific kidney disease on any interventions that may be helpful. But I do that. I exercise often. I avoid certain medications. Of course, as a pharmacist, I'm always aware of that. But NSAIDs and things like that, I do my best. But I'm a human living in this world just like everyone else, and it is difficult. But honestly, I do feel like what's helped me stay in this stability of stage 4 is primarily luck. Because, I have people I know that try really hard and they still end up needing dialysis or kidney transplant earlier in life than me. So it's hard to say what's kept me stable, but I just try to do the common sense measures as much as I can.
How has your experience as both a kidney patient and a clinical pharmacist practitioner influenced your perspective on patient care?
I think that something that has really helped me is empathy. I know what it's like to have a chronic condition that feels out of your control. And I think that's something that very few people have experience with. So that is very helpful for me, especially when I interact with people with type 1 diabetes, which is one of my passions. But also I have experience with trying to do healthy lifestyle measures for my health and realizing that it's difficult. And so, that helps me empathize with a large swath of my patients from all walks of life. But there have been moments and times with patients that have been really meaningful for me in the fact that I learn from them as well. And just having that humility of, I'm going through this too. I don't have all the answers. Like, maybe we can learn from each other. I've found that to be really helpful in my relationships with patients.
So, what advice would you give to others who may be newly diagnosed with ADTKD or other rare kidney diseases?
Mm-hmm. I think what has been helpful for my mindset is this. One blessing of this condition is that it's very easy to hide. It's very easy for me to live a normal life, to choose who I share this diagnosis with, and not feel as I'm other, that I'm different. So I feel extremely grateful that, compared to diabetes or something else, it's not physically evident that I have this condition. So, and this may seem counterintuitive, but I really don't think about it every single day. I do, of course, have that looming feeling of, well, one day I will need dialysis or transplant, and that day is coming. But when it comes to day-to-day life, I live a pretty normal, standard life, and that's a huge blessing. And I also learned from my dad that, not every day is guaranteed. He lived that way and he tried to make the most of it. So anything can be a blessing depending on the way you frame it. And so if someone was, newly diagnosed and they're older and they didn't really grow up with it like I did, I would say, don't let it dominate your life. You can live a completely normal life and think about it as often or as less often as you want, because ultimately it is out of our control. And that can be really scary, but it can also be really freeing too.
And what are your hopes for the future of ADTKD research and treatment?
Yes, my nieces have recently been diagnosed and they're young. And so, although I don't have to worry about my daughter, I do worry about them. And of course, all the other people out there that I haven't even met. So, my hope is that this compound that they are studying now, proves to be beneficial. We can at least stop it in its tracks. Ever since I was young, we've talked about a cure one day, and I still have hope for that. And I hope that we can get the word out so that more nephrologists, more primary care doctors understand that this is a possibility. This is something that can be on their differential when they're looking at people with chronic kidney disease. And so I hope to help bring more awareness to this as a potentially a more common condition than we know about, and eventual treatment and cure.
Thank you, Autumn, for sharing your kidney journey with us today. We appreciate it. As people registered for today's webinar, they were able to submit questions for the speakers. I'd now like to ask our speakers some of the questions that were submitted by our audience members. So we're going to start with Autumn. And the question is, are there any lifestyle changes, treatments, or medications that have helped you in your journey?
Lifestyle measures for me, I love to be active. I think exercise is a really useful tool for so many things, and it doesn't hurt, right? So, just moving in general is really helpful for me to maintain my sense of well being and also just for my mental health. And dietary wise, I um, of course, can't point to a specific study that is helpful in this regard, but I just chose to be more plant based, and I do think that has been helpful for my health in general. Um, and then, as far as medications go, there's not much research out there yet as far as which meds, but I of course take my medicines. I'm a pharmacist. That's important to me. I avoid certain medications like the ibuprofen, Advil, things like that. And then of course I have secondary um, consequences from kidney disease, blood pressure issues, which I take valsartan for. Um, I have the UMOD variation, so I take prophylactically. I've never had gout, but I take allopurinol um, to prevent that, which I'm super grateful to never have had gout. And then I am also anemic, like I said, so I just take iron and vitamin C to help with the absorption of that and a multivitamin. So, yeah, of course, I don't have the magic recipe to help prevent kidney disease from progressing, but those things have been helpful for me.
Thank you. Sharon, this question is for you. Does insurance cover the genetic testing?
That's a great question. The general answer is it depends. First of all, as I think most folks know, insurance coverage varies widely depending on the insurance company, depending on your company and where you get your insurance. So it depends. Now, genetic testing may be covered, at least in part, if your physician, if your nephrologist deems it medically necessary or advisable. So getting a recommendation or having your nephrologist refer you for genetic testing, you'll still want to check with your coverage and your insurance company, but that's a hopeful sign that it could be covered. Um, and there are some genetic testing labs like Natera, that will offer discount for people who has difficulty paying for a full panel or whatever it is they want kept of genetic testing. So I would say definitely look into your insurance, talk to your insurance provider, and it helps if your nephrologist is on board for you to get genetic testing. What insurance companies want to avoid, I believe, is just people being curious and just wanting to get genetic testing for the sake of it. That they won't cover that. If there's a medical need, then I think a lot of insurance companies will at least try to work with the patient to cover some, if not all of that. But definitely check with your nephrologist and check with your insurance company.
Sharon, this next question is for you as well. What motivated you to get involved with the Rare Kidney Disease Foundation, and what are your main goals as its executive director?
Like Autumn says, when you grow up with family members around you having kidney disease, it's both normal, like, okay, this is what is in my family. But it makes you curious. Why? Why have so many of my family members suffered, died prematurely, or died pre-transplant, or had complications with dialysis? What is it that all of us are suffering from? So I've maintained that curiosity throughout my life. And then when I semi-retired a few years ago, and I said, well, I want to volunteer. I want to make a difference in that way. And I found Rare Kidney Disease Foundation through Dr. Blyer. He has family days where you get the families together, as Autumn was talking about. And one of these convenings, there was a representative from the Nelson family, Rich Nelson, and his family, his large family, experienced a lot of disease over the decades and finally, figured out it was ADTKD. And they were starting a foundation. So when I first heard about it, I was very intrigued, and I didn't actually get involved until about a year ago. Because there are answers out there, and scientists are making progress and finding those answers. And as I mentioned personally, I have two adult sons, 25 and 28, and I would love for there to be a treatment or a cure in their lifetime. If they have it, they have not gotten genetic testing yet. It's a very personal decision. I understand that. And they're just trying to launch their lives as best they can these days. So one day they may get genetic testing, they may not, but at least I would love for them to be a treatment for them if they need it prior to undergoing any, painful or prolonged suffering from this disease. Oh, and in terms of my main goal as an executive director, we really need to raise awareness of this disease, which is why, Jerome, I'm so grateful to be here with AAKP today to let all of you patients know that it's a rare genetic disease, but not as rare as we first thought. I mean, Autumn was talking about being part of the first family that was diagnosed back in 2001 is when Dr. Blyer discovered the UMOD gene. And since then, they found 6 more variants. MUC1 was only identified, was it 2013? So between then and now, there's been so much progress made in understanding this disease. And that's largely because Dr. Blyer's studies, he recruits people to be part of the studies. And that's what I mentioned earlier was called the International ADTKD Registry. If you're part of that registry, then you're part of research that is helping to find treatment and eventually a cure. So I was just motivated by my own personal history. And again, the main goal as executive director is to raise awareness, to encourage even, believe it or not, a lot of nephrologists don't even know about this disease. Or if they do, we've heard anecdotally that they kind of throw up their hands and say, well, it's genetic and there's no treatment, so why would I recommend they get genetic testing? Or why even mention it or talk to my patients about it? And we're trying to encourage them to say, well, here's why. There are many reasons that individuals might want genetic testing. Some of the reasons, Autumn mentioned for, childbearing planning. And they're all very personal decisions, but to not have the conversation, to assume that nothing can be done is not the right way to go about it. So we're really trying to educate both patients as yourselves and nephrologists to talk with their patients, especially if they have the red flags that I mentioned. And then if you are interested in genetic testing, you can reach out to us at the Rare Kidney Disease Foundation as your patient advocacy organization, and we can connect you with Dr. Blyer or genetic testing labs, other ways for you to pursue if that's what you want. So raising awareness is a huge, huge goal as executive director, and getting patients, not only for their own knowledge if they have the genetic variations, mutation, but if they're doing these studies, it'll bring us one step closer to finding a treatment, because having a population pool for clinical trial is critical. And this registry could be a potential patient pool for treatment that they'll be testing in a clinical trial in the next few years. So that's our goal as a foundation and my priorities as executive director.
Thank you for that. Autumn, this question is for you. How do you stay positive and motivated while managing a rare disease? And what message would you like to share with those facing similar challenges?
Well, first of all, my heart goes out to you if you have been recently diagnosed. I can only imagine what it would be like as an adult to get that. It would be very different in my experience, just kind of growing up with it. I have been reflecting on this and how I'm able to stay positive. And again, I think it's because each day is something that I feel grateful for. There is so much in my life that I am lucky to have. And it's kind of all around me, right? Like my brother needed a transplant at just 30 years old. My dad, died young, and, most of his siblings did too. So there's a lot to be grateful for if you just seek it out. And again, It's a disease that is easily hidden, easily, you can keep it personal to yourself if you want that. And that's a huge luxury, in my opinion. You know, I was able to go through pharmacy school and in high school, and you know, none of my friends really knew except for those who I wanted to know. So it's not an outward disability like others have. And it's, I think it's all about reframing. I am also have been doing therapy for a long time now, for multiple reasons, but that in itself is super helpful for me too. I'm a person who likes to talk about things out loud, and and to not burden my husband and other family members with my random thoughts. You know, a therapist has been really helpful for me. So first and foremost, I think that would be a great place to start.
This next question is for Sharon. How can patients and families impacted by ADTKD get involved in research and advocacy efforts?
First of all, become a volunteer for the Rare Kidney Disease Foundation. We would love to have you. There's a lot of work to be done in raising awareness. We've got a lot of exciting initiatives going on to do that. One I'll just mention is what we're calling the ambassadors. And these ambassadors, first of all, everything at the Rare Kidney Disease Foundation has ADTKD. We're all volunteers who know what it's like to live with this disease. And so we have so far about 15 volunteers who want to be part of this ambassador program, which is where we will provide you the resources, you know, a flyer to hand out to nephrologists and talking points and, you know, a video that you can play for nephrologists, starting with your own and then maybe expanding throughout your community, but to just raise awareness one nephrologist at a time. And so we've got a lot of excitement around this program, which is just launching, but we've got a lot of other ways that we're trying to get the word out about this condition, this disease. So become a volunteer, check out on our website, and you can do that easily. The other, in terms of being part of research, as I mentioned, is Dr. Blyer is getting more, just had a recent grant, very exciting, to learn more about this disease. For example, to Autumn's point, we don't know from research, why is there variation in who progresses quickly and who, you know, and needs a transplant at 30 and who progresses more slowly, or who is stable? Is it diet? So Dr. Blyer is among a lot of researchers internationally who are just doing groundbreaking research on what do we know about ADTKD. And the way that they're able to learn about this is patients like us get tested if we do end up having ADTKD and join his registry, then that's the sample that they use to conduct all this research. You are part of the cutting edge research to figure out all of these unknown questions, all of these questions with no answers yet. And as I said, an added bonus is, you know, when you've got a ready set of patients in a sample that looks really good to pharmaceutical companies who might want to invest in doing a clinical trial. So the research and learning about ADTKD goes hand in hand with efforts to find a treatment and a cure. So the two things, volunteer with us and join Dr. Blyer's research. By first reaching out to us, we send people his way. So at info@rarekidney.org.
And Sharon, last question is for you. In your view, what are the most urgent needs in ADTKD research, and what promising developments are on the horizon?
So I think I mentioned some of that in terms of what Dr. Blyer and many researchers internationally are looking at. What are things that predict slower or more quick progression of this disease? Is it lifestyle? Is it diet? They're looking at biomarkers, and a biomarker is, you know, like when you take your blood and you get your creatinine tested. That's a biomarker that tells you how your kidneys are functioning. They're looking at biomarkers that you can detect earlier on before there's a lot of kidney damage so that you can understand sooner who's at risk for this disease, and then maybe start those healthy behaviors earlier. So there's a lot of cutting edge research on this. And to that point, I would love to invite you all to the Rare Kidney Disease Foundation is holding its International ADTKD Summit on April 4th and 5th. And what this is on Friday, April 4th is the science program. So from 10 a.m. to 1 p.m. Eastern, we've lined up a bunch of experts who are researching ADTKD, and you can learn more about what they're doing, what they're learning, and progress towards finding a treatment. And then on Saturday, April 5th, from 10 a.m. to 1 p.m. Eastern, is what we're calling the Patient Day. And this is a program specifically targeted to patients and addresses questions and issues and concerns that you might have in terms of some of the questions you've mentioned today. What medications help? What can I do? What demystifying genetic testing, because I think there's a lot of misunderstanding, a lot of concern. Some of it is legitimate, some of it might not be. And so just educating folks on genetic testing, what it is, how safe and confidential your data are. And so I invite you all, and I can work with Jerome if you like to get some information to you about this. But if you're interested, actually email us at info@rarekidney.org and tell us you're interested in attending the summit, and we'll take us from there. It's virtual. It's free. It hopefully, if your schedule allows, it will be an easy and exciting couple days.
I want to extend a heartfelt thank you to all of our speakers from the Rare Kidney Disease Foundation, Sharon McGroder and Autumn Carol Steen. If anyone watching has additional questions for our speakers or about today's webinar that we were unable to get to, please email us at info@aakp.org, noting the webinar title in the email subject line. In closing, if you're not already a member of AAKP, we want to encourage you to join. AAKP offers free membership to patients and family members, as well as living kidney donors. To become a free member, join online at aakp.org/join or by phone at 1-800-749-2257. To receive all the benefits of membership, please be sure to include your email address when signing up. As an AAKP member, you will be notified about all of AAKP's upcoming events, the latest in our educational program series, and when opportunities arise where your opinions and experiences are needed to help inform innovation, advance care, and make a meaningful impact to improve lives. We encourage you to respond to our flash surveys and other engagement opportunities to help us elevate the independent patient voice and change status quo kidney care. You will also receive a digital subscription to our bi-monthly magazine, AAKP Renal Life, and can select to receive any of our 5 different electronic newsletters, all for just signing up. We also invite you to check out our blog to read some great articles and patient profile stories, and follow us on social media for all the latest news and to keep up on what's trending. AAKP is dedicated to helping kidney patients across the disease spectrum understand their condition and take control of their health care. We are proud to offer a variety of resources for both patients and care partners. By visiting our website at aakp.org and clicking on the AAKP Store button at the top of the homepage, you can find a variety of educational brochures and online tools to order or download free of charge, including titles such as Coping, Living, and Thriving with Kidney Disease, conversation starters about questions to ask your healthcare team about choosing the right therapy for you, or changing therapies, as well as nutritional information and much more. You can also order materials by phone. We are excited to announce the dates of our 2025 events. The AAKP National Patient Advocacy Day will take place on March 12th, 2025. This is a virtual event that will allow AAKP members to talk to congressional members and their staff about legislative issues and policies that are important to kidney patients and their families. the 7th Annual Global Summit on Kidney Disease Innovation in partnership with George Washington University School of Medicine and Health Sciences will take place May 22nd and May 23rd. The 8th Annual Policy Summit is scheduled to happen in June and will take place in Washington, D.C. And the 50th Annual National Patient Meeting will also be a hybrid event taking place in October 3rd through the 5th. We invite you to let us know which events you are interested in participating in this year, and we'll be sure to notify you when registration opens. Finally, you can visit our YouTube channel to watch a number of great presentations and webinars, all available on demand from our 2024 events and programs, as well as our 2025 programs as they occur. We would like to once again extend a heartfelt thank you to our webinar speakers, Sharon McGroder and Autumn Carol Steen, for graciously participating in today's HealthLine event. Their expertise and insights greatly enriched the discussion and provided valuable information. And thank you to everyone who joined us.